Okay, if your nerve has been scarred down where you're getting pain down your leg, you're noticing that it kind of comes and goes based on your activity. Like if you've been walking or you take longer steps, you're noticing that your leg starts hurting. Or if you're sitting and you're not putting stress on that nerve, then your symptoms kind of go away. Then this is the talk for you. Now, we did a whole video on explaining the difference between a nerve that has been pinched and a nerve that has been scarred. So make sure you check out that video because the treatments for both of those are very, very different. Today, we're going to be talking about what you do if your nerve has been scarred down. Typically, if you've had something like where we see something like this is where you've had a herniated disc that's been around for a long time. It started healing. It usually takes, 8 weeks for scarring to really develop. So if it's something that's been less than that all of a sudden you started having pain down your leg and it started like maybe 3 weeks ago, this is not, it takes longer time for your nerves to scar. So this is not the exercise for you. But if it's been something that has been going on for a really long time, and the pain kind of comes and goes and it's very consistent, every time I do this is when I notice my symptoms, and then more than likely it is a potential that your nerve has scarred down. Again, make sure you check out another video because we go through an evaluation process to really determine the two things, whether it's a herniated disc or a pinched nerve, or whether it's something that's been scarred down. You also can get scarring down where maybe you had an injury. We've had people that had an injury in their leg and actually it's scarred down and the nerve scars to the muscle down parts of the leg. This still works for those cases as well. It doesn't matter where it's scarred because the nerve that we're stretching is going to be the whole entire nerve. And so that is something that these exercises can help as well. So the exercise that we want to do for something like this, so remember, the nerve is up and it's scarred. Anytime the leg is straight and you're bending forward, you're going to feel it. A lot of times you'll notice that knee will bend if you go forward because you're trying to, and you'll shift your weight. You're trying to avoid that stretch and that nerve. Very, very, very common for something like this. Also very common for a pinched nerve as well when you have dural tension from a pinched nerve. So again, you gotta know which one it is. So we're going to go in when you do this. Again, we showed in the other video that if you go and you bring your knees into your chest, you're really not stretching anything because the nerve is on slack when you do these kind of exercises. So if you're noticing that, nope, no big deal, these aren't a big deal, we want to be very careful because the nerve is super sensitive. This is why you don't want to pull on a nerve unless you really know that it's scarred down. So again, if you're not really sure, definitely get to a healthcare provider that's going to be able to help you really distinguish between the two. And you got to find someone that's good, that really understands this, because the first thing anyone wants to do that we've seen as a physical therapist, the nerve, okay, let's go and stretch it. Well, we've got to figure out, why is it pinched, or is something that's pinching it, or is it really scarred down? So if you're not noticing much with this, great, perfect, that's great. It's kind of step one that we want to do. Step two would be bringing the leg and then just kicking it straight up. You want to go to the point where you kind of feel it. If you feel it, you don't want to push into it. This is not something like, I feel it, I want to push more is better. Not the case. You have got to be very careful. The nerve is very, very, very sensitive. So you want to be able to feel it, but at the same time, it should go away fairly quickly. I'm talking within a few minutes. So if you're noticing that it goes away really quickly, great, not a big deal. You can kind of do that for a little bit and see, and then you can push it a little bit more. But if you're noticing that your symptoms last longer than a couple of minutes, then you're pushing it too hard. Maybe it's not scarred down. You could be really irritating the nerve. So also a big indication that you're going too hard, too fast is if you start noticing pain at night, you are pushing it, you're irritating things. Those are very big things that we need to look at. So again, you'll just kick up to the point where you can kind of feel it and then kind of come back down, and then kick up until you kind of feel it and then come back down. And that's where you'll start out doing something like that. And you'll do that for 8-10 times and doing it 2 to 3 times a day. If that's not, you're like, nope, that's not a big deal. You want to bring it all the way straight. You don't really notice that much. Then you can pull your foot back and then come forward. If that's too much, you can make it where you can have a strap and bring your leg a little bit farther out here. This is going to make it a little bit easier. The farther in you bring it, the more it's going to stretch on that nerve. So you can move your foot back and forth. When you bring it back towards you, that's stretching the nerve. Bring it forward, that's going to release it a little bit. Again, if it's over here, this is going to be an easier version of that. So if this is like, oh, no, no way, can't do it, not there yet, just bring your leg down a little bit farther and doing it this way. And that's how you'll do it. So again, same kind of thing, doing it about 8 to 10 times with the foot. The symptoms, your pain in that leg should go away fairly quickly. If it doesn't, you're pushing too hard. If you're noticing like, oh, I'm not really sure, definitely make sure you get a hold of someone, that understands the back so they can really help navigate this for you. My name is Stephanie. I'm with Empower Physical Therapy, and we help clients all the time avoid surgery, injections, and medication. So make sure you subscribe to our channel because we put out content all the time just to help you understand how to navigate the body and put all the pieces of the puzzle together. Often in our medical system, we only treat a symptom here and a symptom here. We have a specialty here, we have a specialty here, we have a specialty here, whether it's a back doctor, a hip doctor, a knee doctor, but you have all these symptoms and they're not putting everything together because they're only looking at it through one little lens. And that's where it's a mess. That's where we're going into more surgeries, procedures, more frustrations, because I always say where the side of the pain is often not where the source of the problem is coming from. And we have to look at the whole body to really understand what's really going on. Where is this coming from? What structure is really causing the pain and the problem? And that's really what we do well at our office. So make sure you subscribe as we give you more content on a weekly basis.